So basically, this is gonna be a lot, but I filmed some stories on Instagram last night about my journey with acne and also me starting my second round of Accutane. And I've literally never gotten so many DMs ever since I've been on Instagram about anything before. And so I thought maybe it would be a good idea to just kind of put it all into a video and, maybe it can reach more people and help more people than just my Instagram following. A little background story. I honestly remember the moment seeing like that first pimple on my face when I was in, I want to say like 5th grade. And ever since then, I've never had clear skin. So once I got to be a sophomore in high school, I had very cystic acne. So I went to the dermatologist after, trying topicals and antibiotics from my primary care physician. I went on Accutane for 6 months. It did help the cystic acne, but I was never totally clear. And as far as side effects that time, as far as what I remember, I was just very dry. Chapped lips, having to put lotion on all the time, some joint pain, but I was a very active dancer. So I think that affected it a little bit. But, overall, it wasn't a horrible experience. After that first round of Accutane, I'm 24 now, just kind of like for reference. But I waited that typical 6 months to a year before doing anything. And then, I was still struggling with acne. So then I went to lasers, fractional lasers, every topical treatment on the planet, probably, even from other countries. But I went low end from Clearasil from CVS all the way to Obagi, La Mer, you're spending hundreds of dollars on one cream. I've done gluten-free, I've done dairy-free, I've done drink a gallon of water a day. Honestly, you name it, I've done it. I probably should have done this second round of Accutane a long time ago, but probably about 4 or 5 years ago, I was diagnosed with general anxiety disorder. So I think there's some fear in my mind just about, because one of the side effects is, depression, anxiety. So I think that, weighed heavily on my mind about that aspect of it. And just, me trying to want to do these natural methods and just, not be so harmful to my body. But that's a ring on my finger. I am having a wedding in India this year. Big fat Indian wedding. So I honestly just want to be my best self. People who get engaged and are getting married, they want to be skinny. They want to have great skin. We want all of these things because we want to look the best that we can on our wedding day. So that's my motivation to, starting Accutane again. The last probably 2 years, I went to multiple dermatologists getting different opinions, honestly, because I just thought there was going to be one out there that said, wait, you don't have to go on Accutane, you can do this. But literally everyone I saw said, you should go on Accutane. So, working with my psychiatrist, my therapist, my primary care physician, and now the dermatologist that I chose to prescribe me my Accutane, I feel like I have as well as like my family, I have a really, really good support system of all of these people who are in connection, talking to each other, just to really help me on this journey for Accutane the second time, just because of, my concerns. Now to the good stuff. So here it is. I'm taking isotretinoin 20 milligrams in the morning and at night with a meal and a full glass of water. So as far as what it is and crazy side effects and stuff you'll read online, it's a vitamin A derivative. So, you can't get pregnant because if you do have a baby, it'll have a lot of birth defects. So it's very chaperoned. There's warnings like this, don't get pregnant all over the packaging. So what you do, your doctor writes you the prescription. You go to the office one time a month and you'll get your blood drawn. They do a whole panel of labs just to check that everything's, good. You also take a pregnancy test every month, and then you go online to what they call iPledge, and you answer questions about your birth control and just some other random questions. And then you can go to the pharmacy and get only a 30-day supply. So it's intense, it's very chaperone, but you know, that also makes me feel good because it is such a powerful drug and you're really being looked over and making sure everything's okay. As far as side effects and that kind of thing, so you have to be really careful when you're in the sun, wearing sunscreen all the time. It is very hard on your liver, so you can't drink any alcohol. And then a lot of side effects, as far as what I experienced my first round, you just get very dry. So you're putting lotion on all the time, your lips are very chapped. I wear contacts, so I had very dry eyes. You know, some joint pain, and then a lot of people do experience that depression, anxiety on it, as well as, you know, a lot of other symptoms. I did do birth control counseling with my gynecologist because I have been on the pill for a long time, but you know, because of some other health concerns, I did switch to NuvaRing, which I honestly cannot say enough good things about. So I would really encourage anybody who's going on Accutane to do that birth control counseling with their primary care physician or your gynecologist to just see what the best option for you is. I looked into IUDs, implants, a few other things, but NuvaRing was just what was best for me, and I really, really like it. How I'm feeling is, I think, just anxious because I've done this before and I know that the side effects are coming. I'm like ready for the chapped lips. I'll show you at the end my little Accutane, you know, survival kit that I bought, just because I know, you know, what's coming. But I think the most important thing is for anybody out there with acne that feels like they've tried everything and nothing's working for them, go and talk to your doctor about getting on Accutane. And I think you really have to be in a place in your life. Like for me, if this was 2 years ago, obviously I just wasn't ready to be back on it. I think I'm really secure in a lot of other things in my life. And like I said, with the wedding being motivation, I'm really motivated to have clear skin. So this was the right option for me. Acne honestly really sucks. I'm 24. I've been dealing with acne for, I don't know, like 12 years now probably. And I just want everybody out there to know that you're not alone. I think social media is really hurtful for confidence because I know personally I have like blurred my skin in photos before just because it's like society norms to like have clear, perfect Photoshop skin. So I just want everybody out there to know that acne is normal and there are steps and there are people out there and obviously medications that can really help you. You know, if you are hurting, if your confidence is hurting, if you're depressed because you have bad skin, you know, there are other people out there dealing with it and, you know, it is what it is. Okay, so I'm gonna do a little update, you know, showing you my skin because, you know, I think it'll be fun, honestly, for my own personal, you know, reasons to see every month how my skin is changing. So, this is really hard for me to show and I'm being very vulnerable, so here's my skin. And this side is way worse. Okay, so that being said, I'm bringing in all the positive energy. I'm ready for clear skin. I'm welcoming it. And hopefully in a few months, thanks to Accutane, it will be a reality. With all of that, all because of, you know, my getting so many DMs last night, please find me on Instagram at Days, DAIS 97, and DM me if you want to talk about any of this. If you're on Accutane, if you're not on Accutane, if you're struggling with acne, literally anything, please DM me. I'm here for you guys to talk about it because we're all, you know, going through something and a lot of us are dealing with acne. So now what I want to show you guys is my Accutane Survival Kit. I'm not experiencing any side effects right now, but I'm just doing some of these things as like preventative measures. Okay, this is Eucerin Advanced Repair Cream. So look for cream, not lotion. It's more hydrating. Sunscreen, because you're going to be very sensitive to the sun. I suggest ointment body spray, and this is by Aquaphor, but this is something that I really loved last time because after you get out of the shower, you want to put lotion on then and every day. So it's just less time consuming than putting lotion all over your body. It's just easier. I got Cerave Facial Foaming Cleanser. Basically, all you can use while you're on Accutane is cleanser, moisturizer, and some spot treatment. Here is Cerave PM Facial Moisturizing Lotion. So I got this for nighttime, and then I also got the same thing but AM because this has SPF 30 in it. So you want to always have moisturizer on your face. Last time I used Dr. Dan's chapstick, but this time I got this Aquaphor Lip Repair Stick just because they had it at CVS. And, you know, if my lips start getting really, really bad, I'll probably look elsewhere for something else, but I think this will do for now. Then just for the shower, for my whole body, I just got a CeraVe Hydrating Cleanser Bar. And then I'll talk a little bit about these. Here on TikTok, you probably see everybody using these hydrocolloid bandages. Basically, if you've ever seen acne patches like Zit Sticka, anything like Sephora or Ulta, that's basically literally what this is. It's just marketed different in a different shape, and this isn't for acne. So you can spot treat when you're on Accutane, but last time I just remember that when I would spot treat, you're already so dry and flaky that I think this might be a good option for me just when I get like a really big pimple. So I'll keep you guys updated on that as far as like spot treatment if there's something I find that's like better. But you know, in my head right now, why not? I'm just gonna try it. All right, thanks for listening to me ramble. Like I said, just did this because I know other people are out there going through the same thing, and I just want to help somebody and know that people, you're not alone. Other people are going through this, and there are treatments and medicines out there that can help you. So like I said, please DM me on Instagram, follow my journey. I have highlights saved on there, and I'll be posting more of these YouTube videos to just like follow along my journey because, let's do this together. So thank you.